Thousands of nurses and midwives across New South Wales are walking off the job today in defiance of a last-minute order by the Industrial Relations Commission banning industrial action. It'll be the first statewide strike in 10 years and follows 2 years working on the front line of the COVID-19 pandemic in one of Australia's hardest hit states.
Crisis talks between the Nurses Union and state government have failed to resolve a stalemate over pay, workloads and compensation to those exposed to COVID. Let's go straight to Jake Lapham, who's at the Hyde Park rally where they're starting to gather. Jake, good morning. So has anyone arrived there yet?
Good morning, Michael. Not just yet. Many of them are on buses from places like Westmead Hospital, where you've been crossing into this morning, on their way into the city here, where they'll gather in Hyde Park and then walk down Macquarie Street behind me to State Parliament. As you say, it's come after crisis talks between the state government and the Nurses and Midwives Association broke down late yesterday. From there, the state government went to the Industrial Relations Commission and succeeded in getting this protest banned. But the union has come back and said the wheels are already in motion and this strike action is continuing. They're not in a position to call it off at this stage, which will make for some pretty interesting dialogue here today. The Nurses and Midwives Association has been at pains, though, to point out that care in the state's hospitals will continue today, that there are contingencies in place. But New South Wales Health is concerned about delay and disruption that this strike action may cause in the state's hospitals.
And Jake, what in particular is the Nurses Union demanding?
The big one, Michael, is staff-to-patient ratios. At the moment, there's a fairly flexible approach in place, and New South Wales Health says that this allows the right nurses to be in the right place at the right time. But that's completely rejected by the union, who says that that arrangement is placing undue stress on its members. Let's take a listen to Louise Nacken. She's an ICU nurse speaking to your program earlier.
If we have mandated shift-by-shift staff ratios, as they do in Victoria and Queensland and WA, then if we're short-staffed, then those states will close beds. So nurses aren't being made to go the extra mile and have unsafe staffing and lack of care for patients.
The other one, Michael, is pay. The nurses want a pay rise of more than 2.5%. They say that is fair and reasonable, considering that they've been on the front line of the pandemic for the last 2 years. And they also want amendments to the Workers' Compensation Act withdrawn. They fear that those amendments will force them to prove that they've contracted COVID-19 at work before they can access workers' compensation. When all this is said and done, Michael, no doubt both parties will go back to the negotiating table and try to negotiate some sort of deal here.
Thousands are gathering in Sydney to vent their anger at a pay freeze and a lack of compensation if they happen to contract COVID. Others in regional areas are also taking action by walking off the job. Among them is theatre nurse Brianna Braga, who joins us now from outside Broken Hill Hospital in the New South Wales Far West. Brianna, thank you so much for speaking to us this morning. Good morning.
Oh, good morning. Thank you for having me.
Why are you joining this action today?
I guess we are joining the strike today because we are, we're exhausted, we are tired and we are suffering out here, and our government isn't listening to us, We've been fighting for safe staffing, particularly nurse-to-patient ratios for years, and our government just continues to ignore our pleas.
Take us through.
That's why we're striking today.
Take us through your day-to-day working life at Broken Hill Hospital. How much pressure are you under?
I guess, it's the same in every hospital across New South Wales. We're understaffed, and I guess it's coming to work with the uncertainty. And I guess with, the current climate and the pandemic, it's that... I guess that heightened feeling every day, the pressure, the overwork, the overtime that we're doing, the shifts that we're picking up, because, it's just exhausting, to be honest.
Now, there's been a pay freeze for a few years. The government is offered 2.5% pay increase. They have offered to negotiate that. What will make your working life much easier, Brianna?
To be honest, look, it's not even about the pay rise. It's about safe staffing, and nurse to patient ratios. At the end of the day, like, you know, it's not uncommon for one nurse to be looking after up to 8 patients on a ward by herself, and it's even worse with midwives. You know, they could be looking after 5 mothers, but those babies aren't counted in the numbers. So not only are they looking after 5 mothers, but they're looking after 5 babies as well, and it's just it's unsafe at the end of the day.
Absolutely. It is unsafe, and gee, I'd imagine there's not much time for breaks for nurses in that situation.
No, and that's something that we're really fighting for as well, particularly in the union. You know, a lot of our nurses have over shifts, they choose not to take breaks. And we're really just trying to push for nurses to take more breaks because we're getting burnt out.
Now, we often hear, and it's the case with the New South Wales government, Brianna, the Premier and the Health Minister repeatedly and quite justifiably describe people like you as the true heroes of the pandemic. What do you reckon about perhaps action not matching those very nice words?
Oh, I think it's just, you know, like they call us heroes, but, you know, 2020 was the year of the nurse, and they thanked us by giving us a pay freeze. And as I said earlier, you know, we've been trying to plead with them for safe staffing for years, and yet they just keep ignoring us. We've got the ACT, Victoria, Queensland. They've all got mandated shift-by-shift nurse-to-patient ratios. Why doesn't New South Wales? You know, it's just quite frustrating. It's upsetting, really, because we just want to do our jobs, and you know, as a collective, nurses across New South Wales, we can't do our jobs without the safe staffing.
Brianna Braga, thank you so much for joining us this morning.
Thank you. Thank you for listening.